Good afternoon, everyone, and a very warm welcome. I am Deeksha Nangia from Prudent Insurance Brokers. I would like to thank all of you for joining today's webinar session. Did you know breast milk is the best food to help your baby grow and develop? Breast milk helps your baby fight off sickness and diseases. Being a mother myself, I know breastfeeding is not always easy, but is always worth it. It's a mother's gift to herself and her baby and to the Mother Earth. We are joined today by Dr. Shachi Baweja. She's a leading name when it comes to specialty lactation in pediatric treatment in India. She has been widely acknowledged for her versatile and patient-centric approach. She's MBBS DCH specialist, infant and young child feeding, and IBCLC International Board certified lactation consultant. Presently, she is working as a senior consultant in pediatric department at BLK Max Super Specialty Hospital, New Delhi. Without any further ado, I hand over the session to Dr. Shachi Baweja, and we will also be launching some questions in the poll, which you all can answer. And you can park your questions in the question and answer box, and we will attend them at the end of the session. Over to you, Dr. Shachi.
Right. Thank you, Deeksha, and hello to all of you who are joining us. I feel from different parts of India, and thank you to the Prudent Healthcare Insurance Brokers for having me. So today we are going to talk about the whys, hows, and wows of breastfeeding, or as some of you would like to call it, nursing. Before I go into details of my session, let me just tell you a few things about myself. Diksha, I'm seeing this poll on my screen, and my screen, yeah, it went off. Yeah. So whatever I'm telling you today is not just bookish knowledge. It has come from my career graph or my career trajectory. So who am I and where am I coming from? I was a trained pediatrician and I was practicing pediatrics in 2001. And I thought I knew a lot. And then I had my first child in 2005 and I realized that breastfeeding is not as easy as it sounds. We very casually tell all parents you should breastfeed, breast milk is good for your baby, breastfeeding is good for you. But then what about the challenges? So I faced those challenges and I was not able to get any support from my pediatrics colleagues, from my gynecologist colleagues, from my extended family, mother-in-law. Everyone had their own stories and their own guidance to give, but none of them solved my challenges. Somehow I was able to breastfeed my child, but it was not a very pleasant experience for me. It was very stressful. It was very traumatizing, and somehow I felt I could not enjoy my child as much as I would have been able to if I was able to take things in an easier way. So that is what led me into getting trained into the field of lactation. So I did my infant and young child feeding course and started working as a lactation professional. I stopped practicing pediatrics. But then I realized there is so much more to learn. So I got an international accreditation called IBCLC, or International Board Certified Lactation Consultant. So I became that. And then I realized there is so less of us and so many of us who are trying to get this information, this knowledge, and there is very less resources available. So that is when around 7 years back, Association of Lactation Professionals India, which is a body of lactation professionals working across India. Why am I mentioning it is because towards the end of the poll, I'll give you an excellent resource for your breastfeeding. In case you need any breastfeeding support, you can get information there. So as a result, after all this, we started working on lactation, and I currently work for the last 13 years at BLK Max Hospital in New Delhi, and I also have my lactation support clinics. In addition to all that, I am actively involved with training of doctors, nurses in various aspects of breastfeeding, because that is what was lacking in the first place because of what I had challenges. So I started with my own challenges, but currently I'm working with parents who have challenges. So the way we are going to talk today might be a little different than what you are accustomed to. We'll try to understand what breastfeeding is, because I feel if we understand something, we are able to achieve better results and we are able to follow things through. So the purpose of this decision, this talk is to help you make an informed decision. Informed decision means when you are weighing the pros and cons of certain things, seeing how they can be beneficial to you, what are the challenges that you might come across, what if you don't do those things. So if you weigh the pros and cons, you are able to take better decisions. I'll pause for a minute and I'll ask Diksha. Diksha, do we have the results of the poll right now? Can you give me the
Yes, Dr. Sachi, I will just share for the first question. I'll just share.
yeah,
Can you see
right.
it?
Yes, I can see it.
Yeah.
Right. And the next question?
I'll just share the poll one. I'll just launch the
Right.
poll once.
Right. So why we are doing this poll, or why I gave them this poll, is commonly when we talk about lactation, nursing, we commonly use the term breastfeeding. But I totally acknowledge the fact that all nursing parents might not identify as moms or she or her, or might not like to call their mammary glands as breasts. So just for my this thing is I am using the term breastfeeding or she her as the nursing parent. Right. Do we have the answer for the next poll?
Poll. Give me a minute, ma'am.
Yeah. So when you answer this poll, it will help me in modifying the talk according to your specific needs. Okay, so maybe I can continue till people are at, oh yeah. Are you currently expecting a baby? Do we have the answers, Diksha?
When people are answering, we'll just share it.
Right. Yeah, thank you. So what we can do is it possible that I continue my talk and as you get answers, you share with me? Will it work?
It is 70%, ma'am. I'm just trying to share it to you, but it is 70% people have answered it, and it
Yeah.
is. Person is yes.
Oh, wow, that's nice. So I think
20% is yes. Total answers are 70%.
okay, 20% are yes. So we have 20% of expecting parents here. Right, right. Okay. So do you think we can quickly move to the next question? And that can be the last question. I don't need further answers beyond that.
Just give me a minute, ma'am. Is the next question visible, ma'am?
Yeah, it is visible that if anyone is currently nursing or breastfeeding, so they would mark yes. And we don't need more answers beyond this. So 3 questions will give me a fair idea.
Sure.
Thank you.
The total yes is 43%, ma'am.
Okay. Oh,
No,
that's
50.
right, right. So let's move ahead. And thank you for answering these questions because it helps me in understanding who I am speaking with. So as we were talking that when we talk about breastfeeding, when we learn about breastfeeding, it should be in a way that it allows us to make informed choices. What is it that I would like to feed my baby? If I'm currently nursing my baby, what else do I need to give my child? Actually, do I need to give anything to my child? If I give something else to my child, what are the pros and cons? So that is what we mean by making informed choices, right? So what is breastfeeding and why breastfeeding? Very simply put, we are all mammals, and mammals are characterized by the body feed their babies. They feed their babies on their own bodies. Some call it nursing, some call it breastfeeding, some call it body feeding, and there are many terms for that. And when a person is pregnant, what happens in the body is there are lots of changes. So we have seen or we know that pregnancy has trimesters: first 3 months, middle 3 months, and the last 3 months. There, the breastfeeding or lactation period is known as the fourth trimester, wherein both the nursling as well as the parent, nursing parent, they get back to their original self, to their pre-pregnancy self, and by nursing these changes happen in their bodies. And the nursling is able to adjust to the outside environment by being in close contact with the mother, because when the baby is inside, the baby is snug, the baby is cocooned, the baby is floating in warm fluid. The baby has never touched anything, the baby has never worn any clothes. Once the baby comes out, it's a scary world for the baby. So with the act of breastfeeding, when the baby is kept body to body or skin to skin with the mother, and the baby suckles at the breast, every time the baby is wanting to feed or is in any kind of distress, and the mother or the nursing parent puts the baby on the breast, the baby suckles, relaxes, goes off to sleep. So breastfeeding helps in smooth transition of the baby from in utero to the ex utero life, inside uterus to outside uterus. And another very unique quality of the milk that comes out of the body is these milks are species specific. Like a cow's milk would be specifically suited for the baby of the cow, for the calf, the way calf's brain is, the way calf's body is. So whatever content is there in a parent's milk would be more suited for the parent's offspring. So having said that, when we talk about breast milk and when we talk about non-human milk, so all other milks are non-human milks. It can be what people commonly call as fresh animal milk or theli ka doodh, dairy ka doodh, or it can be things like box milk or formula. So comparison is not possible because again, each species has its specific milk composition. So like you can say, you cannot compare say coconut oil with petrol. Likewise, you cannot compare human milk with non-human milk because human milk is a living fluid. By living fluid, I mean it contains many live cells, and the milk's composition keeps changing according to baby's needs, according to time of day, according to the weather, according to the environment. For example, if a baby is sick and has some infection, baby's saliva gives that infection to the mother's chest or breast, and mother's breast starts producing antibody or immunity against that and helps in the settling of the infection. So it is like customized with each and every day, with each and every need of the baby. Whereas formula, yes, it is used as like it is used interchangeably commonly, but formula has a fixed composition. So if you look at the name formula, So it is made based on a formula. So they add certain things to make it similar to breast milk. They decrease the concentration of certain things in the animal milk to make it look or appear closer to the breast milk. So yes, it takes care of some of the nutritional needs of the baby, but it is not similar to or comparable to human milk. So I do not want you to read this slide, but I just want you to understand and to look at the right side picture wherein you can see an iceberg. So the benefits, when we talk about the benefits of breastfeeding, we just see the tip of the iceberg. We only see the tangible benefits, but there are many, many, many more benefits that can only be felt if someone is able to breastfeed comfortably. Having said that, I would also say that breastfeeding is said to be something very natural. Breastfeeding is said to be something very common, but please know that it is a learned activity. So like walking is something that is natural, but you learn to walk as you grow big, as you become around 1 year, you reach different milestones and you slowly learn how to walk. Like that is breastfeeding, and I'll take you through that. So babies benefit in many ways, because when a baby is drinking milk from the parent's chest or breast, from the mother's breast, the milk is rich in immunity boosting substances. One, another way to look at it is when the baby is drinking from the parent's body, baby is not needing to drink things from outside. And as a result, the chance of inducing infection also goes down. So breastfed babies are protected from all sorts of infections. Not to say that they will not catch infections, they might catch infections, but they recover much more quickly. Breast milk is customized, as we discussed in the last few slides. It provides optimal nutrition. So when I say optimal, I mean whatever is needed is there in the amount in which it is needed. So nothing is more, nothing is less. Whatever the baby needs is provided in the milk of the baby's mother or parent. It is very easily digestible. So a very interesting fact is that the protein content of human milk is pretty low. The iron content of human milk is pretty low. But if you compare it with those powder milk, box milks, they have much higher protein content, much higher iron content. Does it mean that that is more helpful or that is more beneficial? No. Human milk is more beneficial because the absorption, or what we call as bioavailability, or the digestibility coefficient of breast milk is much higher. So even when it contains smaller amount of protein, it is absorbed in a much better way as compared to the animal milk. When the baby feeds with the parent, with the mother, the act of close body to body hug, eye contact, looking lovingly at each other, that also helps in developing the IQ, because the baby's brain develops with that interaction. Plus the specially designed breast milk which is present in mom's milk, which is rich in things that help with the brain development. Altogether, they help in better IQ of breastfed babies. Likewise, all sorts of developments are better when babies breastfeeding. Protection we already discussed, and bonding. So whenever a baby needs, the baby is held, baby is fed. So baby develops a secure attachment with the primary caregiver, which again is mostly the nursing parent. We always talk about the benefits to the babies. We rarely talk about the benefit to the moms, but it is equally beneficial for both the people in the diet. So yes, bonding because of the hormones that flow during breastfeeding. Protection, because when baby suckles at mother's breast, the blood loss that happens after delivery or cesarean, that actually is less if the baby is actively suckling. You might not get periods or might get shorter periods when you're breastfeeding. That also prevents the blood loss from your body and thus helps you in protection against anemia. You are usually eating well, taking iron supplements when you're breastfeeding. So thus it helps impacts your iron levels. They are better. Many kinds of cancers. So we are protected against many kinds of cancers when we breastfeed. But again, a disclaimer, it is not that those who do not breastfeed will definitely get cancer. Please don't take home this message. The message that I want you to take home from here is, if you are breastfeeding, so the amount of time you breastfeed, the longer is your protection against certain kinds of reproductive cancers. Diabetes, blood pressure, postpartum depression, all these have a lower incidence in moms who are able to breastfeed, and breastfeed comfortably, right? And when a mother is breastfeeding, breastfeeding hormones helps with internal healing of the body. Now, we say that it is natural, it is hassle-free. Yes, it is, when the mom gets correct kind of support, both in the healthcare system as well as in the family. And if things are going right, then definitely it is one of the most hassle-free things to do. But if things are not going right, it can be one of the toughest things to do. Relaxing, again, yes, if things are going fine, baby is latching well, right from day one, baby is breastfeeding, you don't have much challenges, or if you have challenges, they are quickly sorted out by discussing it with a trusted lactation professional. Yes, it is ultimately relaxing because you release relaxing hormones in your body. And yes, it is an excellent parenting tool. So those of you who have kids who are nursing and who have taken your babies for vaccination, you might have realized that once the baby gets jabbed and starts crying, all you need to do is put the baby on the chest or breast and feed, and the baby becomes quiet. So why is it that some breastfeed and some do not? Maybe they do not get correct information, or more probably they do not get the correct support when they need it. Because breastfeeding is a process, it is a cascade of events. It is not just putting the mom and baby together and everything will come naturally. So there are so many factors that impact whether someone would be able to successfully breastfeed or not. So can you do something, those of you who are still pregnant, can you do something so that you can get off to a good start? Yes, actually, when you prepare in pregnancy, you are much better equipped with knowledge, skills, resources, and you're able to do it better. So prepare yourself. Then once you have your baby, now sorry, execute what you had prepared. So when I say execute, I mean do it, do what you have learned. And when I said prepared, I meant join some antenatal class, read about breastfeeding, learn about breastfeeding, go and visit a lactation consultant or attend an online breastfeeding preparation workshop. So they will teach you how to communicate with your healthcare providers, with your family members, how to make a birth plan so that everyone knows that you have decided to breastfeed and they don't give anything else to the baby, because this is one of the common reasons why babies would not latch immediately if the babies are separated from the mother or given something else. And then execute is like following this plan once your baby is born. And last but not the least, troubleshooting. So if you have challenges and you were trained antenatally, you will know how to tackle those challenges, right? So moving ahead, typically preparation involves acquiring knowledge, acquiring skills, not just knowing that breastfeeding is good for you, not just knowing what are the practices that help with better breastfeeding outcomes, but also skills like how to latch on the baby, how to know if the baby is latched on well, what are the different ways to feed the baby, things like that. And these are covered in antenatal classes. And also collecting resources. If I have challenge, does my hospital have a skilled lactation professional? If I'm having challenge, who should I reach out to? Do I have a lactation consultant in my city, in my community close to me? Do I have the appointment numbers? So these are the things that will help. And in fact, studies have shown that when you start learning about it before your baby is born, so those parents, families who acquire antenatal education and support are always able to get a better start. And if you have started well, there are probabilities that you'll face less challenges. So how you can help your own breastfeeding journey or someone else's breastfeeding journey? Invest in a good antenatal session or workshop. For that matter, if you have someone in your family who's pregnant, you can always register for some good antenatal class and give them that registration so they can go and attend that class, and that would be a beautiful gift to give to a expectant couple. So here is a picture of one of my antenatal classes. I do in-person classes as well as online classes. This is a picture of an in-person class wherein one of my colleagues is talking to the expectant couples. So we are talking about what happens immediately after birth. So that brings me to various topics that are covered in antenatal classes, in these antenatal classes. So we talk about benefits, we talk about recommendations, we talk about how birth impacts the process of birth feeding. What are the practices that are conducive with breastfeeding, what are the birth practices that can impact. We also talk about early days, infant behavior, how to know if things are going well, how to reach out for help, when to reach out for help, and topics like that. So they are pretty fun, these classes. And one of the benefits or things that are not written here is, when you are attending such class, be it online, be it in person, actually you are amongst a group which are in a similar situation like yours. They are also expectant parents or new parents. So you get a peer group. And many times what I've seen is, after these people attend my antenatal classes, we have groups for them, we have WhatsApp groups for them. So what happens is, they start interacting with each other and they keep supporting each other. So that's a beautiful thing to be had, right? Now, how do you execute what you have learned? Because we were talking about three things: prepare, execute, and troubleshoot. So how do you execute? The most important thing is, stay active and healthy throughout your pregnancy. Eat what you're supposed to eat judiciously, don't indulge too much, stay healthy, be regular with your workouts, be regular with whatever exercise your healthcare provider has taught you, so that nearing the pregnancy you do not develop complications like blood pressure, sugar, and all that. Because if your pregnancy is smooth, if your pregnancy is healthy, there are less chances of intervention, there are more chances of natural birth. And as a result, if you have a natural birth, you are more independent, vis-a-vis if you have, heaven forbid, a interventional birth or a surgical birth. You are lying down for first 24 hours and you'll need someone to help you with that, and you'll be dependent on someone, right? Second important thing is, communicate clearly with your healthcare providers and family. This is something that is often overlooked, but I have seen lots of breastfeeding journeys getting jeopardized, because the moment baby is born, there is a big group of family members, because everyone is excited to see the baby. But what is happening? Everyone is just holding the baby, and the initial period wherein the baby and mom should be together and breastfeeding should be initiated, that part we miss. And as a result, babies are overtired, not latching well, not breastfeeding well, and as a result getting something else. So it's a good idea, if you talk to your family, let them know what you're planning to do, let them know how they can help you without coming to the hospital, when they can come and see the baby, and things like that. So good healthy communication with family members is very helpful. Also communicating with your healthcare provider, so letting your doctor know, letting the team of nurses know that we do not want to give anything else. The moment baby is born, as early as possible, we would like to put the baby on the breast and breastfeed. Have support at hand. Again, so many times I get families wherein someone is staying with the mom overnight after cesarean or delivery, and they say, I have back pain, I have had pain, I won't be able to help with breastfeeding. It is understandable that they are not able to, but maybe we can have instead someone who's comfortable, who has no challenges, and who can repeatedly help the mother. Because again, see, even if the mother had a normal delivery or a cesarean, at the end of the day, she's a new mother and might need help and support. And also it is helpful those hospitals wherein you have round the clock lactation support. That is the ultimate, I would say, in lactation support luxury. And also, please ask your hospital if they have a skilled lactation support person on hand. Ask them if they are available, what can be done to help you. If that is not available, you can figure out who's there in your city, in your community, and you can touch base with them, and they can help you during the initial days if there is no one in the hospital. So for smooth sailing, like what happens the moment baby is born? If the moment baby is born, if the baby is kept in immediate skin to skin contact with the parent, and the baby is not disturbed, and of course this is applicable to full term babies who are totally healthy, where there are no medical challenges. So the baby is capable of searching for the breast and like moving towards the breast, and is able to latch on and start breastfeeding on its own. And this is called, actually this has a name, this is called breast crawl. I would urge you all to go home and look at the breast crawl video. Golden hour is the first hour after delivery wherein the baby is most active, and it is seen if the baby is put on breast, babies are able to feed beautifully at the breast during this hour. And after that, the babies usually go off to sleep and breastfeeding becomes a little challenging. But yes, in skilled hand, it can be done. Then supportive environment. Your family should be supportive. Your healthcare team should be supportive. You should have someone who can help you with positioning and latching the baby, right? And opposite of all that we have discussed, it can hamper not doing skin to skin contact, giving something else. Some families do have practice of giving things like honey and all, although that's not medically approved, but still some families would want to do. So maybe communicating in the early days before the baby comes is a good idea. So when we did last survey, the National Family NFHS, National Family Health Survey, what we realized was only 55% of the babies are breastfed, or rather 55% of the moms are able to breastfeed. So it is said that not many women breastfeed for as long as they would like. I would like to phrase it a little differently, and I would like to say not many women or parents are able to. So the difference here is, again, in my experience, this is my clinical experience, most of the parents would like to breastfeed their baby only because they face challenges and they do not get correct and timely support. Do they resort to giving something else or not breastfeeding? So mostly when we talk about what are the causes, why do parents are not able to breastfeed or why do they stop, there can be many causes, right? It can be a personal cause. Maybe you don't have knowledge awareness. Maybe you have incorrect knowledge. Maybe you have certain personal traumas and beliefs, any past experiences. Many times mothers who have had very bad breastfeeding experience in their previous pregnancy would say, I don't want to breastfeed because this happened last time, or because I never produced milk and like that. Maybe it is a person's personality. Some people get easily disheartened or discouraged. Some people will just keep on trying. So personal causes can be there, but mostly the majority of the causes which play a role in our lower breastfeeding rates, again, this is my personal experience, is lack of healthcare system support. So mostly our healthcare providers are unaware, unskilled, and they have time constraints. So when I say this, I do not mean to criticize the healthcare system. What I mean to say is, when we train as doctors or nurses, we are never taught about breastfeeding. The only thing we are taught is breastfeeding is good for the baby. Now, how to do it, how to help a new mother, we have not learned. And how do I know this? Because more than 40% of my clientele in my clinics is healthcare providers, people who are doctors themselves. And when they struggle, then they realize, oh my God, this was never taught to me during my medical school. And yes, time constraints, because a pediatrician who's seeing, say, 10 families in a single OPD or in a single ward round will not have time to sit with you for an hour helping you latch on. But yes, if his team has skilled lactation professionals, or if his nursing team is skilled and trained with breastfeeding support, they'll be able to help you. And the same is applicable to any family member who is skilled and trained. Then environmental causes. Many times the environment is not conducive. Many times there can be difference in opinion in the families. Many times there can be so much promotion of animal milk around you, so many people around you giving formula milk, and like you are in a kind of non-conducive environment. Societal causes. We see when we are breastfeeding, it is so challenging to feed the baby maybe in the market or in the restaurant without everyone just eyeing you and looking at you and saying, oh my God, what is she doing? You are feeding your baby like they are sitting and eating in the restaurant. It is exactly same. The baby is eating his or her meal. So as long as we do not have a society who's openly supportive of families, of parents, of mothers who breastfeed, like nursing in public should be a thing. We should see lots of parents feeding publicly, and then only it will, like the hitch around it or the hesitation around it will go. So when your baby is born, ideally your healthcare team is supposed to support you with latching, is supposed to support you with challenges like nipple pain, injuries, and all that. But again, please understand that not all hospitals have skilled lactation support at hand. So they might be able to help you, might not be able to help you. Remember that if you were not able to breastfeed while in hospital, in all probability, the support was not skilled enough, or maybe there was something lacking in the guidance. Please reach out to a lactation professional. Likewise, once discharged, if you are in touch with a peer support group or a lactation counselor who's kind of helping you with initial troubleshooting or initial solving of your hiccups, that would be very helpful. So again, researchers have shown us that if parents get timely and optimal, on time and what is needed, that kind of support, they always continue breastfeeding. And I can give you thousands of examples of parents who had initially thought, okay, maybe I'll just feed for 6 months, and then they continued feeding for 2, 3, 4, 5 years. So again, there are many factors, and one of those is paid maternity leave. So when a parent has peaceful time, they are sitting at home, they have the leisure to feed their baby on demand, it is mostly encouraging. Vis-a-vis if they are supposed to join back work at 2, 3, 4 months, they are always anxious and they would want to get their babies accustomed to bottles and other things so that when they go, their babies are able to feed. Thankfully, India has a very strong maternity protection or maternity benefit act, wherein we get essentially 6 months of paid maternity leave. So everyone, each one of you who's here can play a role. Right from if you're riding in a bus and you see a mom breastfeeding, please give her your seat. Please make sure that you're not staring. Please make sure that you don't make her feel uncomfortable. Likewise, if you are in a trial room and there is a mom who's not comfortable feeding sitting outside, you can very well offer her the trial room and maybe wait for trying your clothes and help her breastfeed. So what I mean to say is each one of us has a role in protecting and supporting breastfeeding. Now, my most favorite people when I do this talk is dads, because dads are so keen on helping the moms, but more often than not, they get confused because they don't know what to do. And again, postpartum, mostly as moms, we are so exhausted that we often get irritated, and we often kind of fight with our husbands because they are not understanding the kind of stress we are going through. But dads, please know that we value your support. Dads or the non-nursing partners, I would say. So how you can help: give your partner a massage, reduce stress for them, maybe make a shield for them against the visiting relatives, maybe cook something for the nursing parent to eat, burp the baby, cuddle the baby, put the baby to sleep on your chest, care for the baby in other ways like changing the nappy, singing lullabies for the baby, putting the baby to sleep. There are n number of things that you can do. And also, last but not the least, appreciating your partner for the effort that she's making in breastfeeding the child, because after all, it is a joint venture. It's your baby too. And families can and should support, and when families support, things go beautifully. So families can take care of elder siblings, families can show empathy to the mother, family can help with cooking meals, they can take care of other things, other household chores, and can support with breastfeeding, and also not raise questions on mothers or parents' decision to breastfeed, not discuss whether she has enough milk or not, helping her schedule an appointment with a lactation professional if needed. Common prevalent myths which more often than not sabotage the breastfeeding relationship: flat or inverted nipples. Guys, what do we say? We say breastfeed. We never say nipple feed. So should it matter if the nipple is projected or flat? No, usually it does not matter. If the baby is latching correctly, if you can look at the blue picture that I've shared on the screen, babies usually grab at a larger part of the breast, not just the nipple. So irrespective of the kind of nipple mom has, all babies should be able to breastfeed. If you're facing challenges or if you're told something like that, please ask for skilled lactation support. And likewise, chota breast, bada breast, small, big, huge, all have different milk making capacities, and none of them is non-conducive with breastfeeding. So it's not that if the breasts are small, they will produce less milk, right? Again, myth: breastfeeding after cesarean section is not possible. It is absolutely possible. All you need is for someone to position the baby on the breast in a way so that baby can grab a large mouthful of breast and baby feels supported. So again, if you are someone who is expecting your baby, please go home and do your research, learn how you can help latch on your baby, ask for skill support in the place where you are going to deliver. Milk supply myths. Initial days, babies cry, babies are not latching correctly, mummy is feeling nipple pain, baby keeps suckling for hours and is still not dissatisfied. Commonest perception, I have less milk, or maybe the mom has less milk. Mostly no, it is the way baby is suckling. So again, you can look online or you can attend a good antenatal class which will teach you the latch dynamics, how the baby should latch, how to ensure that your baby is latching well. In fact, a very good resource to go and look at is Global Health Media Project videos. So you will find lots of latching videos and in many regional languages. So you will be able to, if you want, see it in your regional language if you have any. Food or diet related myths. If I'll eat this, I'll produce more milk. If I will eat this, my baby will get gassy. There is no scientific evidence for that. So simply put, if the baby is latching well, latch is the term we give to the way baby grabs the breast. If baby is latching well and withdrawing milk well, mostly the parents or the mother's supply will build up based on whatever baby is taking out. So it is a demand and supply principle. If the baby is latching well, your milk supply is going to increase. The traditional or cultural things that we give to the new mothers or new parents, they are helpful. They are good energy giving to the parents and they might help support lactation. But on their own, if the baby is not latching well, not suckling well, mother is not expressing milk, they will not be able to support the milk supply. Myths related to multiples. If you have twins, you'll not be able to produce milk for two babies. Again, not true. If you get correct timely support with latching both the twins or maybe latching and in addition to pumping your milk or expressing your milk, trust me, you can produce milk for three babies also. Pumping myths. Pumping should not be done. Pumping will damage the breast. Pumping will cause breast sagging. Pump milk is unnatural. You hear so many things, but please know, using breast pumps correctly as per the manufacturer's instructions under the guidance of a skilled lactation professional can actually help in maintaining milk supply in situations where due to any reason your baby is not suckling correctly at the breast. It could be you're separated from your baby because of some health issue of yours, or the baby was born premature or had any challenge. It could be because you're not able to latch the baby correctly. It could be you're joining back work. So again, remember demand and supply. So if your baby is not suckling at the breast, you can use a pump or you can use your hands to express. That is a technique that you can again look online. You can learn by watching the videos how to hand express, or the lactation professional in your antenatal class can teach you. So basically, pumping or taking out of milk is not something that is harmful in any way. If you're facing challenges with directly feeding your baby or you have to join back work, you can very well work with a lactation professional and learn how to express and store your milk for your baby. Medication and breastfeeding. For every second medicine, I'll hear that I was told not to breastfeed because I'm taking XYZ medication. There are excellent resources where you can actually put the generic name of the drug and you get correct information whether that medicine is actually harmful or not. And there are just I would say hardly 3-4 medications which are contraindicated during breastfeeding. There is hardly any that's contraindicated. LACTMed, LACTMED, ToxNet, TOXNET is an excellent website, excellent international database where you can get information about all medications. Now, the mother of all myths, breastfeeding is easy. Girls these days do not want to put in effort. Everyone gives up so easily. Trust me, it is not. But yes, if you get correct guidance, it is still hard work, but then things start falling into place. Like any new thing which you learn, which you start doing, be it cycling, be it playing a sport, it is hard work in the initial days and there is a learning curve. But if you get correct guidance, you master it. The same applies to breastfeeding. So it needs hard work, it needs planned effort, and it needs all-round support, be it from your family, your doctors, your society, your country, everyone. Common challenges: painful breastfeeding, sore nipples, baby getting staying dissatisfied at breast, sleep deprivation, concerns about babies not gaining enough weight, breasts becoming painfully tight and engorged. These are the common challenges that parents encounter during initial days. Please know, all of them are related to suboptimal latching at the breast. Remember latching, the way baby is being put at the breast. So learn, if you are still pregnant, if you are nursing and have any of these challenges, again look up either Global Health Media Project videos, or you can go to my website, which is drbaveja.com, short form for doctor, and these videos are there. They might help you. A very good resource for you, as I promised you in the beginning, is the Association of Lactation Professionals India website, wherein you'll find a service directory which has state-wise list of lactation professionals in different states, trained lactation professionals. So if you are having challenges, don't delay it. Quickly schedule a consult with a lactation professional who can help you with your challenges. So this is my presentation. Thank you for your time. You are most welcome to put in your questions.